Good evening, everyone. I want to welcome you for this Thursday evening training once again. I hope it finds you well and ready to spend the next 1 hour discussing Q&As as well as other aspects of our business. So from wherever you are joining us, whether you are here on our continent of Africa or further afield, it's a warm welcome to you. As we draw ever nearer and nearer to the festive season, I hope that you are very psyched to have a very nice time. And my apologies that last week was a bit of a disaster, but we did our best with the challenges we were having. And today I am still going to do Q&As. And today's session, I wanted to backtrack a bit on an issue from last week, where there is a question today that is actually related to the matter of kidney disease that we were discussing last week. So the first question I have here is about chronic kidney disease in a person who is diabetic. And you'll remember, if you were with us yesterday, sorry, I forgot to introduce myself. For those of you who are new and joining us maybe for the first few times, my name is Oloo, a long-time distributor of Neolife products, and very excited and happy with the work that we do. And that is why it's always a pleasure to spend time with you speaking about our products. So last week we spoke a bit about the kidney and kidney issues, and you may recall that I mentioned that one of the leading causes of chronic kidney disease is diabetes. Of course, there are other causes. For example, it's also closely linked to high blood pressure and so on. So a question came along about a diabetic who has chronic kidney disease. And the first thing I want to recommend for this is to go to the source of the problem, which is the diabetes. And so the first recommendation would be botanical balance and tree and N, so that we address the diabetes issue. Because remember, even if we are trying to help with the kidney disease, the base issue, which is the diabetes, will continue to do damage on the kidney and other body organs. So that is the first recommendation, botanical balance and tree and N, to help begin the resolving of the diabetes. And then you will again recall, if you are with us last week, that I mentioned that chronic kidney disease is divided into 4 or 5 stages, in which by the time you reach stage 4 of kidney disease or kidney failure is actually acute, and by stage 5, you'd be requiring either dialysis or a kidney transplant. The first stages, that is stage 1 to 3, there is trouble brewing, but we can still help by what I'm saying, that we deal with the problem of diabetes. And at the same time, we recommend for those who are in stage 1 and 2 of kidney disease, we can recommend Beta-Guard to help the kidney with detoxing, and also vitamin B complex, which tends to be deficient in people who have chronic kidney disease. So again, you'll remember that we say that someone who already has problems with the kidney has challenges in dealing with any substances that we add to the body. And that is why our recommendation for people who have got kidney disease has got to be very focused and only a few products, so as to minimize the load that is going to be placed on the kidneys. So that is why, in the case of someone who is in stage 1 or 2 of the disease, we'll recommend botanical balance, tree and N, Beta-Guard, and vitamin B complex. The botanical balance and tree and N is to deal with the diabetes, and then Beta-Guard and B complex is to help the kidney with the issues of the disease. If the person is already in stage 3 of kidney disease, then we would replace the Beta-Guard with vitamin C, sustained release. So here the option of sustained release is the best one, because the vitamin C tablet has 200 milligrams of the vitamin, but it is released gradually every 6 to 8 hours. There's a release of the vitamin into the blood. This way, the amount of it that is the kidney has to deal with is going to be minimal, and that way saving the load on the kidney. In addition to vitamin C for stage 3 of kidney disease, we recommend that they either ensure that they get sun exposure. If this is not an option, then they would need to also add vitamin D vegan for the person who has stage 3 kidney disease. Always you'll notice that especially if we are here in Africa, where we've got good, strong sunlight, particularly in the equatorial area, we don't necessarily have to supplement with the vitamin D unless for one reason or another, either through the debilitation by the illness or our work or living situation makes it difficult for us to get adequate sun exposure. So if there isn't enough sun exposure, remember that sun exposure requires that our skin is exposed to the sun. And this will make it not particularly necessary to supplement with the vitamin D. But if we are not able to get sun exposure, then that is a recommendation for the CKD stage 3. So those are the recommendations for chronic kidney disease in a diabetic. And then the next question was another one that is I'm going to speak about for a little longer because it was several aspects of the same problem, which is blood clots in the circulatory system. So normally the blood should not be clotting when it is within the circulatory system. It's supposed to be in a liquid form. Clots are supposed to occur only in sites where there is injury because they are the body's way of starting the process of stemming bleeding and closing the wound. Unfortunately, there will be time when blood clots form within the blood vessels, and this will imply that there's either poor blood health or poor circulatory health. And you will recall, for those who have been attending training for a while, we do have a separate topic where we speak about cardiovascular health, where we speak about the issues of healthy blood and a healthy circulatory system. So I won't go further into that, but just to say that it is not normal to have blood clots when the blood is within the vessels. It should only happen at the site of an injury. Unfortunately, sometimes we find that the blood vessels themselves have been damaged and clotting issues can start occurring within the blood vessels, and that can actually lead to serious and dangerous blockages to the blood supply. So I had 3 questions, which, as I said, are the aspects of the same clotting issue. One was a heart attack, another one was thrombosis. Thrombosis refers to a blood clot in either a vein or an artery. And the other question was about a stroke. And the 4th question was someone who is having seizures after having had a stroke. So I'll mention briefly about a point or two about each of them. So as I said, blood clots can cause dangerous blockages in the blood supply. So for instance, if the blockage occurs in the blood vessel that supplies the muscles of the heart, that is when we speak about a heart attack, because then that muscle is going to be deprived of oxygen, which means it is going to fail to do its job of contracting for heartbeat. So then we say that the person has had a heart attack. When the blockage, when the clot causes a blockage in the brain or in a part of the brain, then we refer to it as a stroke, and this can lead to some serious problems and damage in the brain. If the blood clot blocks blood supply to the lungs, then it is called a pulmonary embolism, and this again can cause some severe problems. So as you can see, these are blood clots occurring in places where they're not supposed to be and causing blockage to the blood supply, which then leads to a dangerous situation, whether it is a heart attack, a stroke, or a pulmonary embolism. So the first thing I wanted to mention here is that this particular issue of abnormal clotting of the blood within the vessels has got a lifestyle connotation within it. And so some of the lifestyle points that we should take away is that we should incorporate movement and exercise in our lifestyle, because this plays a part in a healthy heart and also in a healthy circulatory system. Then the other thing is to clean up our diet by eliminating problem foods. You'll remember from the many times that this has been mentioned, eliminating foods like sugar, refined sugar, things like refined carbohydrates and factory fats, all of which contribute to either poor health, poor quality of blood, or causes damage, contribute to damage to the blood vessels themselves, leading to this issue of abnormal clotting of blood within the vessels. So the lifestyle points are important, and we should take them to heart by increasing the amount of movement and exercise in our lifestyle, as well as cleaning up our diet, eliminating junk food. Junk food, remember, is almost exclusively made of refined carbohydrates, as well as which are fried in factory fats, and sugar added to them, as well as several food additives such as preservatives, colorants, and so on. So by eliminating this from our diet, we are going to be reducing our toxic load. We are going to be reducing inflammation within our bodies, including our body tissues like the blood vessels. Then on the Neolife side, we'll recommend ProVitality, which contains the four supplements. This is omega-3 salmon oil that is important to blood and blood vessel health. It will also contain threonine, which is important for cellular function. So it's a nutrition at a cellular level. And then it will have a multi-mineral and multivitamin. And then it also has carotenoid complex that is an antioxidant. Then apart from ProVitality, we are going to recommend lipotropic adjunct, a very important preparation that contains several important nutrients, including members of the vitamin B complex, and this plays an important role in healthy blood and healthy blood vessels. Then we also recommend garlic allium complex, which is important in the same area. And lastly, especially where we have got a heart attack, we'll recommend coenzyme Q10, that is important in the health of the heart itself. A few points to mention of caution. If a person has had a heart attack, their cardiologist, that is their doctor, might give them blood thinners. That is some medication that helps to thin the blood. And if they are on blood thinners, you need to discuss with the doctor whether it is okay to take omega-3 salmon oil or a supplement like vitamin E, because these ones also thin the blood. So if someone has had a heart attack, be cautious about omega-3 salmon oil and vitamin E, because it can compound the effects of the blood thinner. If the person is using blood thinners, then instead of omega-3 salmon oil, we would recommend that they add vitamin C instead, until the doctor tells them that it's okay for them now to stop using the blood thinners. They would usually have to be on the blood thinners for 6 months or even more. So it requires a certain discussion with the cardiologist or the doctor. Then the other point of caution I wanted to mention was that once a stroke has occurred, so in the case of this, the first point was about heart attacks, but generally about blood clots. The second point is that once a stroke has occurred, the supplements can only help to prevent future strokes. You cannot stop a stroke that has already taken place. So the supplements will help in preventing future strokes, as well, or helping to recover from the effects of the stroke. Because when a stroke takes place, some of the effects is that certain brain parts might start malfunctioning and lead to problems such as impaired speech or impaired movement and so on. So the supplements are targeted towards, and it is also a point that if a person has had one stroke, the chances of having another one is increased. So it is valid that we should use supplements to prevent any further strokes, because the more strokes a person has, the more it compounds the damage that is caused to the brain and therefore the function of the person. Then mentioning here about the question about someone who was having seizures after having had a stroke, just to say that it is often found that seizures can occur after a person has had a stroke. So it's a common side effect that comes after a person has had a stroke. And of course, the seizure can lead to further damage to the brain. And so if a person has had a stroke, we recommend that they take the recommended supplements with any adjustments in terms of blood thinners. And we also recommend that they add vitamin D, because the person who has had a stroke may have reduced sun exposure because maybe they are not able to move about as freely as they were doing before. And if they are indoors most of the time, they may not be having enough vitamin D, and vitamin D does play an important role in recovering of function after a stroke. So again, vegan D would be an important supplement for someone who is recovering from a stroke. In addition to that, occupational therapy may be recommended to help the person regain some of the functions that might have been lost as a result of damage to the brain after a stroke. Again, of course, these are very distressing situations, and we should be careful how we approach them to avoid overpromising, because we do not know to what degree the brain might have been damaged by the stroke. So we do not know to what degree the supplements would be able to help. Of course, we know that they help, but the extent to which they will help will depend very much on the extent of the damage and how repairable it is. So, okay, moving on to another question. This one was about stomach cancer. And here the recommendation, as always, for cancer, the first one is phytodefense, which is made of 3 different types of supplements, concentrates of fruits and vegetables. So phytodefense will contain carotenoids, it will contain flavonoids, and it will contain cruciferous plus within it. In addition to that, we'll recommend chelated zinc and omega-3 salmon oil for the person suffering from stomach cancer. Then another question I had, which I will go into for a little bit longer, is about viral hepatitis. So the term hepatitis, as you might know, is inflammation of the liver, and it has various causes. The question that we have at hand was about liver hepatitis that is caused by a viral infection. But we can also have liver problems that are due to excessive drinking of alcohol, as well as excessive taking of junk food that is sugary, because the liver is one of the organs that suffer when we do not control our sugar intake. So problems with the liver can originate from a viral infection, it can originate from excessive alcohol use, and it can also originate from excessive use of refined sugar and refined carbohydrates. So the question today was about viral hepatitis, and the person was asking about the 3 types that are commonly spoken about. This is hepatitis A, B, or C. So just to introduce them, hepatitis A is a short-lived viral infection and does not become chronic. So it is an infection that can be got, let's say, from unclean hands of an infected person does not wash their hands and can infect others, especially because the hepatitis viruses are able to live for longer on surfaces, like, let's say, on counters and on utensils and so on. So if there is someone in the household who has hepatitis type A, they may infect others, but it is a short-lived infection that tends to clear up within a period of a few months. Then we have the other 2, hepatitis B and C, which can also begin as short-lived, but in their case, they can linger within the body and become a chronic hepatitis. That is a chronic inflammation of the liver. Unfortunately, if this happens, that is, if the hepatitis is chronic, then it can lead to liver damage, and further on, it can lead to liver cirrhosis, and even, unfortunately, to liver cancer. So quite one of the leading risk factors of liver cancer is the presence of hepatitis in the hepatitis virus in the body or in the liver. Now, the damage to the liver by these viruses is also going to be exacerbated by the excessive use of alcohol, as well as of smoking. Because if you recall, when we are speaking about our detox organs, the liver is the #1 detox organ, followed by the kidney. And it means that any toxic thing that we are going to be putting in our body, or any chemical substance that we are going to be putting in our body, is actually be going through the liver. And if the liver is already challenged by a viral infection, then its ability to cope with things like excessive alcohol and smoking and other toxins is going to be reduced, which means that the destruction to the liver tissue is going to be speeded up. Fortunately for us, the kidney tissue can actually regenerate itself. So anything that we can do to help the liver function is going to promote the regeneration of the liver, and we can actually go back to a normal liver by taking some lifestyle and medication, vaccination, and so on, back to a healthy liver. So then hepatitis B is an infection, unfortunately, which can be symptomless. That is, a person may be having the hepatitis C or B, but they would not be having any symptoms. And for this reason, one of the important things to make a point of is, especially for expectant mothers, they should be screened, or people who are planning to have children should be screened for hepatitis B and C, because of the problem that an infected mother, or a mother who is carrying this virus in her body, because the virus does tend to linger and hide in the tissues of the body, such as the liver. At the time when a woman falls pregnant, the stress on the body brought about by pregnancy can bring the hiding virus back into circulation. And when the baby is born, the baby can actually be infected with this virus. And when a baby is infected with hepatitis B or C virus, it will almost always be a chronic issue. So they will have a chronic hepatitis, which will be important for them to be cured of. Luckily, there is a vaccine that is available even for newborns. So if unfortunately the mother is positive of hepatitis virus, then the baby immediately after being born can be vaccinated. And that way you would avoid the issue of infecting the baby with the hepatitis. So just wanted to mention those as some points to note about hepatitis A, B, and C, and especially the fact that there are vaccines, and the fact that it's important for families who are either expecting a baby or planning to have a baby should be screened for this virus to prevent passing it on to their child, because in that case, the child will have chronic hepatitis B or C, and we have seen that these are actually can lead to some serious problems of the liver. Then on the lifestyle side, the hepatitis B and C are usually transmitted through bodily fluids. That will include things like sexual relations. It can also include things like syringes which are contaminated. And of course, as I mentioned, during the birth process, the newborn can be infected. So another lifestyle issue is to avoid toxins such as smoking and alcohol. As I said, this will exacerbate the problems of the kidney. Sorry, of the liver. Apologize for that. I meant the liver. And there is treatment and medicines for these hepatitis B and C. Unfortunately, they are still quite expensive, and I'm not sure if they're widely available. Also, there are vaccines, and I don't know to what degree they're widely available, but for maybe the person who was asking about this, it would be a good thing to ask your doctor to find out what exactly is available that can help on the medical side. On the supplement side, we'll recommend vitamin D. We can use the vegan one, or vitamin A plus D. We would also recommend chelated zinc, vitamin B complex, as well as flavonoid complex. We could recommend phytodefense, but if maybe there is some financial constraints, at least there should be flavonoid complex in the mix. So these supplements are going to help with the health of the liver, and they will also help with reducing the viral load, as well as also boosting the immune system. So vitamin D, either as A plus D or vegan D, chelated zinc, B complex, and either phytodefense or flavonoid complex from the Neolife side for those living with hepatitis. And as I've said, there are some important things to note there on the lifestyle side and what can be done for people with that problem. Then a question that I've received on a number of times is about brucellosis, which is a bacterial infection that usually is contracted as a result of either dealing with livestock or using raw milk from either cattle or goat milk. So raw milk is milk which has not been pasteurized, which is a healthy food, but unfortunately it can harbor some of these disease-causing bacteria, which affect both the livestock but can also affect variants, can also affect human beings. And my first recommendation was to consult a doctor for antibiotics. And also, if we notice that, because in this case, I suppose the question was chronic brucellosis, that the person keeps on getting the infection, this could be as a result of reinfection. So to examine and treat animals which might be having brucellosis, and also to boil the raw milk before using it, because that will kill the disease-causing microbes. Also, in addition to boiling the milk, not to forget to boil the strainer, that is the sieve for sieving the milk, because sometimes you might boil you might boil some of the buckets and so on and clean the buckets very well, but you forget the strainer. So to boil the strainer, the utensils, and the raw milk itself to kill the disease-causing bacteria. In addition to that, as I said, to visit the doctor for antibiotics, and also to use ProVitality to boost the immune system, and vitamin A plus D will also assist for brucellosis. Another question was about keloids. So keloids are thick scar tissues that occurs in certain people after the skin has been injured in some way. Let's say from a road accident that there has been some extensive skin injury, or from other types, let's say from an operation where the skin has been cut. When it heals, it might form. This happens to certain people, it's not to everybody, but to certain people, the scar tissue might be quite thick. And keloids tend to be more common in people of African and Asian origins, because we tend to form thicker scars when our skin is injured. And unfortunately, is not a very easy thing. So again, here is the supplements may have a limited effect. So just to let the person know that success here might be not very assured, so the keloids might not respond. Unfortunately, it seems that keloids can be quite stubborn, and even when they're surgically removed, they can come back. But we recommend carotenoid complex, vegan D, and chelated zinc for people who are trying to resolve keloids, and hopefully that will do the job. Then the next question was someone who is quitting smoking and wants supplements that can help them in quitting. So the first thing that we recommend is a lifestyle point, which is to find an alternative coping mechanism because a lot of times smoking is a means of coping with stress and so on. If you are going to stop smoking, then you need to find something, an alternative, a healthy alternative for the role that was being played by cigarettes in your life. And you can take up something like exercise or walking to deal with stress and so on. And then on the Neolife side, we recommend supplements that are usually deficient in smokers, and this will be vitamin C, sustained release. We are also going to recommend Formula 4. We recommend Beta-Guard for detoxing, and CalMag as well, which is deficient in people with people who smoke. So vitamin C, Formula 4, Beta-Guard, and CalMag. Another question was about the difference between vegan D and vitamin A plus D, because in some markets you have both. So vegan D allows vegetarians to supplement with vitamin D, as vegetarians and vegans, because as you know, vegans do not take any kind of animal products, and vegetarians limit the amount of animal products they take. So vegan D, it makes it possible for them to supplement for vitamin D, because vitamin A plus D contains animal products from fish, and this may not be something that vegans want to use. So for those of us who are not vegetarians or vegans, we can use either of them, vitamin D or vitamin A plus D. If someone is a vegetarian or a vegan, they may opt to use vegan D. And of course, as I said, if you're in the equatorial climates, of course, you can opt to get your vitamin D by sun exposure. Okay, the next question was about back pain, and another question was about scoliosis. So scoliosis is a condition in which the spinal column is a bit bent, so that the back is bent at an abnormal angle. So these are two aspects probably of the same thing, because scoliosis can lead to back pain and other pains in other parts of the skeleton. And here, the first recommendation is to see a doctor, because sometimes surgery, in the case of scoliosis, surgery may be required to correct it. On the lifestyle side, the recommendation is to see a physiotherapist or a chiropractor who might be able to manipulate the spine to correct the problem, or to suggest useful exercises that can help to get rid of the problems of the back. Also, another lifestyle point is to maintain good posture, because many of us spend very long periods sitting down, and if we sit down in a slumped position, we put our spine in a very awkward, problematic position, which can with time lead to back problems and back pain. So to maintain good posture, that is when we are sitting, we sit upright with our back straight up rather than slumped, and that way avoid putting our spinal column under a lot of stress. Again, as I said, there are exercises that help to strengthen the back muscles so as to maintain the back in its proper position. Then we recommend Pro Vitality, which will contain omega-3 salmon oil that helps in reducing the inflammation associated with back pain and scoliosis. And then we also recommend Full Motion that helps in regeneration of cartilage where it might be worn out. And then we also recommend Magnesium Complex that helps in the same area. Then the next question was someone who wanted to know if any of our skincare and personal care products include sunscreen. And this is just to say that Neolife does not have any sunscreen in our grooming products. And this is because so far our researchers have not found a formula that is entirely non-toxic. So many of the ingredients that are used in sunscreen actually contains toxic substances. And so we do not have sunscreen in our grooming or other skincare products. Also, just to keep in mind that the sun is not our enemy, as I've severally mentioned. It helps us to manufacture one of the most important vitamins, that is vitamin D. So we simply need to be judicious about when and how long we expose ourselves to the sun. Then I think the last question that I'm going to talk about today. I think that if we're having a session next week, we'll continue with the Q&A because we've had quite an accumulation of questions. But for today, my last question will be one where someone wanted to know how to take Aloe Vera Plus. Aloe Vera Plus is our probably one of our families, many of our families and friends' favorite drink, because not only is it healthy, it is also tasty, and it's always a temptation to take a lot of them. I remember that when our children were young, they used to almost have a homing hearing device that could hear when we open a bottle of Aloe Vera Plus, and everybody would come running from wherever they are and find out if they could have some. So it is a much loved drink in Neolife. And what we can say is the required dose will be 1 or 2 shooter glasses. I do not have a sample of a shooter glass, but it's a small glass that you use for taking shots. So that one, 1 or 2 shot glasses in the evening will be what would be recommended. Again, it does not have any side effects to cause concern. But if one takes 1 shot glass, it's enough for having the desired effect. Again, as I said, we use it for many celebrations and toasting and so on, because it is a refreshing and healthy drink and does not have any side effect unless you are particularly allergic to aloe products. So I want to thank you very much for having spent time with me this evening answering these questions. I know that quite a number of the questions that you have sent have been in backlog, some because we have had a bit of a challenge retrieving them from the chat, but we are making progress in them. And as I've said, if we'll continue next week, we shall have another Q&A session. So do not be discouraged if we did not get to your question. And as always, you can send the question directly to me by WhatsApp or by SMS, and then I'll give an answer directly to you. So for now, I want to hand you over to Pascal, who is standing by, ready to take you through the business session for today. And I want to wish you, as we start in South Africa, from today, we are starting the public holidays that kicks off the festivities. So we are already wishing each other a happy festive season.
Thank you very much, Betty. I think those are quite a number of questions that I think distributors have many questions in the field, and it's our pleasure and Betty's pleasure to answer all these questions. Things to do with the product, especially the health supplements. What I want to take you through now is about building the business. 2 things I want to share with you this evening. One is the basics of our business. And I think that whatever we do, either it's sports, either it's studies, whatever it is, if something is not working well or as good as it's supposed to be working, we need to go back to the basics. The basics simply means the fundamentals. What are the basics of our business? So if you'll allow me, I want to share the screen with you from the start. All right, what is our basic? What are the basics of our Neolife business? How do we build a business? Remember that Neolife is our partner in the business. We are the ones who create the market or customers that use products for Neolife. What are the basic things we do? The basic idea behind our business is to move products from Neolife to different consumers or different users. How do we do that? We do that by doing 3 things every day. Number 1, we use the products ourselves. Why is that important? Because first and foremost, we are supporting our own business. Number 2 is that we want the people we recommend the products to know that we also believe in the product. So the first step about building your business is use the products yourself. The second one is sharing the products and the opportunity. That simply means the people who are not interested in the business to become promoters or distributors or business builders become our customers. I would recommend that in the new year, I would like you to create a new goal. if you regularly supply 4 to 5 customers, make it a new goal in the new year or in January or even this month. Make it 10 customers. If you regularly supply 10 customers, make it 15 or 20 customers. Because the more customers you serve with the products, the more profit you make, and the more bonus or commission you get at the end of the month. So the second thing is share the product and share the opportunity. Simply means sponsor other people in the business. And there's a material difference between recruiting and sponsoring. Recruiting means getting people to join. Sponsoring means getting people to join, training them to do what you do, supporting them in their business to grow. That is what sponsoring means in the business. And the last thing we need to do is personal development. Taking time to learn about the business, taking time to practice what we do in the business, taking time to be a leader, and taking time to have the right attitude to build your business. This is you. What do? You use the products. This is very critical. And I think Betty has spoken to about this pro-vitality, but I want to focus on something very specific about our business. The foundation of our products or nutritional supplements is 3NN. Since 1958, when Formula 4 was developed, Formula 4 is 3NN plus vitamins and minerals. Later on in the 2000s or 2011, the company decided to make 3NN specifically a unique product for the marketplace. Why? Because it's a very unique product for cellular nutrition. So if you're starting the business, I want to recommend that you need to learn how to explain 2 products. One of them is LDC, and the other one, the other one is 3NN. You need to know how to explain what 3NN does. And it's a very simple process. I don't think it should take you more than 2 or 3 minutes. This is a 3NN explanation. You see, what is the human body? The human body is made of individuals, of organs. The organs, let me retract a bit. The human body is made of systems, organ systems, the circulatory system, the breathing system, the structural system, the muscular system, all those. But all those systems, or those organs, are made of cells. We have 73 trillion cells in our body. The status of your health is determined by the status of the health of your cells. In this picture, you see an unhealthy cell, the unhealthy cell of somebody whose diet does not have 3NN. Nutrients cannot go in, waste cannot come out. Then we have what is called chronic fatigue syndrome. Okay, the cells of the membrane of the cells is supposed to be soft and permeable, but because you don't have 3NN, that is the 3 essential oils, the cells are dry and impermeable. So nutrients don't get in, waste doesn't come out. If you have healthy cells, the cell membrane is soft and permeable because it has the 3 essential oils, omega-3, omega-6, and phytosterols. Phytosterols simply means plant-based oils. Okay, so a healthy cell, the healthy cell membrane is soft and permeable, nutrients get in, waste comes out, and the cell is healthy and generates energy. That is what the 3NN presentation is. It takes it takes less than 3 minutes. I want to recommend every distributor to learn this presentation. Go back, in fact, let me check on our product brochure, the product catalog. If you go to page 8 of the product catalog, there is that explanation of how 3NN works. Teach every single distributor you sponsor to learn how to explain 3NN. Why am I emphasizing this? Because first, 3NN is a foundation of our nutrition program. Number 2 is the basis of moving products. If you explain even to a lay person, somebody who has never heard about nutrition, explain 3NN, they'll express an interest to buy 3NN. So how do you get to 100 points? Use one 3NN, 17 PV, get 5 customers to use 3NN, you've got 102 PV. That is the foundation of our business. Okay? So learn how to do the 3NN. Once you learn how to do this, the people you sponsor, first of all, you need to have at least 6 customers. This will get you to 100 PV, 200, 250, depending on the volume of number of customers you have. If you have 3 people who are doing 250 and you're doing 250, you've got 1,000 PV, you have become a senior manager. All right? You get bonus and profits. The next thing is you duplicate yourself. That means you teach other people to become senior managers. If you help 3 people become senior managers, you are also senior manager volume. You've done a director business. All right? That is the essence of our business. 3 things: use the products, share the products and the opportunity, and then personal development. Then you duplicate yourselves to get other directors in your group. You earn sales volume bonus. You earn leadership development bonus. All right? Then the next thing I would like to discuss with you is to make 2024 the best year you've ever had in the business. Last night, I stayed up until about 12:30 or 1 o'clock South African time. I was attending a training by Eric Warren, and he mentioned a number of things that I've been thinking about also. The quality of your life will be dependent on the quality of the questions you ask yourself and the quality of the answers that you generate to those questions. Okay? The quality of your life in the next year will be determined with the quality of questions you ask yourself and the quality of the answers you generate to address those questions. If you want to make 2024 the best year you've ever had in this business, I asked myself those questions too. The first question I'd like to pose to you is this: what is your reason for not taking your next step? What is your reason for not taking your next step? What is the reason why you haven't reached the goal that you set for yourself, or you haven't reached the level that you want to reach in the business? I want to recommend to you all to go after this training, before you go to bed, take a paper and a notebook and a pen and write down the reasons why you think you're not successful, or the reasons why you think that your business is not growing. I can name a lot of them out of just head. Lack of focus, lack of daily discipline, lack of consistency, fear, lack of skills. All write down your own reasons, and please be as brutally honest with yourself as you can, because it's your future. So ask yourself the question: what are the reasons why you have not taken your next step? Next question: if the above reasons, the ones you have written down, if all of them were taken away, if, for example, you said one of your reasons is lack of focus. If you actually had focus, if, let's say, your reason was fear, if you remember, you cannot eliminate fear, you can only face it. Because in the human soul, either you have fear or faith, but you can't have the 2 of them in your soul at the same time, either fear or faith. Okay? So if the above reasons were taken away, would you commit yourself 100%? Would you go all out to build your business without any excuse at all? And I will give you a tip on writing the reasons. Remember, if the reasons you're writing is dependent on somebody else, your business won't grow. It has to be a reason within yourself, because you have 100% control of what is within you. You don't have any control over your sponsor, your upline. You don't have any control on what the company does. You don't have any control on what the markets are. You don't have any control over your prospects. You have control over what you do, right? So if the above reasons were taken away, would you commit yourself 100%? The third question, are you, one, willing to learn the skills to build this business? The 7 skills: identifying prospects, inviting prospects, showing the business, doing a follow-up, getting new people started, promoting events, and servicing customers. Are you willing to learn these skills? If you don't have the book by Eric Worre, The 7 Skills of Professional Networkers, get an audio from your upline. There's an audio book, in fact, done by the author, free of charge. Get a copy. Second question, are you coachable? Are you willing to listen to somebody who is more successful than you? Because one of the things that really trips people in the business is not to listen to a growing sponsor or a growing upline. And this comes from ego. There is no beating about the bush. One of the most challenging things about our business is ego gets in the way of your bank balance. The bigger your ego, the smaller your bank balance. Number 3, are you hungry for success? How badly do you want to succeed in 2024? How badly do you want to take your next step? Number 4, this is now when the rubber meets the road. Are you willing to go through, or are you willing to accept embarrassment and rejection from your relatives, your friends, and your prospects? This one was a very tough thing for me. I remember when we started the business, I invited one of my friends to see the business, and after we finished, he told me, Pascal, you're an engineer and you're selling soap. I really got devastated, and I went to my sponsor, Johannes van Eden, and he burst out laughing. He said, now I know you're doing the business correctly. Okay? 7 months later, I equaled my salary. So, are you willing to accept embarrassment? Are you willing to accept low social esteem from people who don't understand the business? The next thing, are you willing to learn and get the guidance from a mentor, somebody who is more successful than you are? Are you willing? In fact, do the following: plan, do, review. That means after this session, spend the next few days thinking about the questions I've asked. Create a plan for you to take your next step. If you're a distributor, make the plan to do 100 PV consistently. Make the plan to sponsor 2 people who do 100 PV. Make a plan, then put into action, then review and see where you are wrong or where that needs improvement. Then the next thing is give yourself a radical permission to think big. You know, yesterday when Eric Worre was talking about this, then he suddenly produced a model of a private jet that he has bought. It was really, for me, it was really quite something that really inspired me, that you need to make a radical, think as big as your imagination can take you. Because what happens is that your brain will actually expand and begin to start believing that it is actually possible to achieve some of these things. So give yourself radical permission to think big. Make a commitment, focus yourself on building the business, acquire all the skills that are necessary to become successful, and last of all, be kind to yourself. Don't whip yourself so hard when you don't achieve the goals that you set for yourself. Because everybody has got challenges. Everybody is going through tough times. Right? Be kind to yourself. If you make a mistake, acknowledge it, correct it, move on. If you make a mistake, keep doing, be very kind to yourself. And that means you also need to be kind to others. Okay? You see, what I have found about this business is it's in your own interest to be kind to the people in your team. There is no business on the face of the earth like network marketing. There is no business on the face of the earth like Neolife business. It is better, it is for your own good that you be kind to yourself and be kind to the people in your team, because they will always remember you with fond memories. Yesterday, Brandon Masondo and Drew McDermott gave us a report. They've just returned from America for the annual meeting of the top Neolife staff. This is Jerry Brasfield's vision for Neolife: to be the top 10 largest network marketing companies in the world in the next 10 years. The question is, how much are you going to contribute to that vision? How much are you going to contribute to that goal? What are you willing to do to make this vision a reality? First, personally. Number two, for your team. Number three, for the whole organization. So, ladies and gentlemen, those are some of the things that Betty and I wanted to share with you in this training session. And I hope that some of the ideas we've shared with you are going to make a difference in your life. Our business is very simple. Don't make it complicated. It's not an easy business, because the biggest challenge we're going to face is ourselves. It's not our downlines. It's not anybody else. The biggest challenge we have in this business is facing ourselves and giving ourselves permission to think big. So, ladies and gentlemen, I want to thank you all very much for having spent this evening with Betty and myself. We wish you every success in whatever you're doing. I see some of you are really running with the business for the month of December to achieve your goals before the end of next week. I wish you the very best. We'll have another meeting on Monday for the last business presentation for guests. And then on Thursday, we'll have the last training, because there's a lot of backlog about Q&A. Alan, we want to thank you very much. We want to appreciate Alan for what he does for us. Alan is in the middle of exams, and despite having exams, he's always there to support the team, to host our meetings. Alan, we want to thank you very much. Ladies and gentlemen, thank you. Good night and God bless.